Now, about 30 to 50% cases of cancer can be prevented, and also preventing cancer offers a long-term strategy for or cost-effective strategy. And the World Health Organization has linked tobacco use as the greatest risk factor for cancer cases, killing about 6 million people every year globally. Our topic of discussion today is throat cancer. We will be demystifying for you all there is to learn about throat cancer. And in studio, we'll be having two important guests. One is Dr. Mbira, who is an ENT expert, and also will be joined by Caroline, or Dr. Caroline Muturi, who is also a head and neck expert. But most importantly, we'll be having a throat cancer survivor, and his name is Ezekiel. He will be taking us through his journey with cancer. So for now, I'll ask you to sit back, relax, and learn from this exciting show ahead. But remember, you're always welcome to be part of the show by maybe calling us in or even using our Twitter handle to talk to us on Twitter at Ebru TV Kenya, at Purity_Museo. Use the hashtag #MyDoctor, and also use the number that will be displayed right at the bottom of your screen to talk to us or to call us live. My name is Purity Museo. You're watching My Doctor Show, which is just starting in a moment. Welcome back to the show. Today, our topic of discussion is throat cancer. Remember, you're welcome to be part of the show. The number will be displayed at the bottom of your screen that you can use to call us live. And also in studio now joining me is Dr. Mbira Gikonyo, who is an ENT expert, or surgeon rather. And we do have Ezekiel Libamira, who is a throat cancer survivor. Welcome both of you to the show, and thank you so much for joining us. Yes, I'm glad to have you on board today as we discuss about throat cancer. And just before we get into the discussion, Doc, would you kindly just take us through the statistics of where we are as a country in terms of numbers for diagnosis for throat cancer? Are the numbers increasing, or what would you say as an ENT surgeon?
Yeah, as most members of the public are aware, cancer is increasingly a very, very important disease. And many, many people nowadays die of cancer as opposed to the past. And part of this is that there's better diagnosis and also greater awareness among the public of this illness. And there are various forms of cancer. Almost any part of the body can actually get cancer. But of course, throat cancer is one of the most important cancers, and is also one of the ones which can also be easily prevented, depending on nutrition, depending on personal habits, and depending on how one lives their lives. So cancer is increasingly important. And as the infectious diseases like malaria become less important because they are well treated, you find more and more people will end up being affected by cancer because they live for longer and they're no longer being affected by the infectious diseases.
And Doc, we've had discussions about cancer, and most oncologists will say that there is no known cause for cancer. But you've mentioned something very important, that throat cancer is a cancer that can be easily prevented. Do we have known causes for throat cancer?
Yeah, we have certain risk factors. For example, people who smoke more than 20 cigarettes a day or for more than 20 years, many of them end up getting throat cancer. So there's definitely an association between smoking and throat cancer. There's also an association between taking alcohol, especially great quantities of alcohol, and especially poor quality alcohol and throat cancer. So those two are lifestyles that people can actually change. They can stop smoking, they can stop taking that kind of alcohol, and that can help them. There are also other factors, something like we call human papilloma virus, which can also contribute to that kind of cancer. Something else is something we call GERD, or gastroesophageal reflux disease. This is when acidity comes from the stomach coming to the throat. And this can also be easily treated. And so if people avoid those kind of things, it can help them. Also diet. If you have a diet that is poor in vegetables and fruits, then you can also end up increasing your risk for cancer. So all those are things that one can actually do: avoiding smoking, avoiding alcohol, taking a good balanced diet, and even getting a vaccine for the human papilloma virus. All that can actually prevent throat cancer.
Yeah, and when you talk about throat cancer, which part of a human body are we referring to here?
Yeah, the throat, I don't know whether there's a diagram which may come up, but the throat is basically found in your neck and is generally known as the voice box. That is the principal part we're talking about. And it is divided into three parts. The vocal cords are the middle part, which we call the glottis. Above the vocal cords is what we call the supraglottis. And then below the vocal cords, the subglottis. So those are the areas which are actually affected. The throat, of course, is one of the most important parts of the body, principally for three reasons. Number one is voice production. Many of us in medicine, as teachers, as lawyers, as politicians, as preachers, as singers, depend on the voice for earning our living. If you cannot talk, you're unlikely to be able to earn your living in many And therefore, that function of talking is one of the most important. Even in family relationships, instructing your children, talking to your husband or wife, all that is very important for social life, even talking to your friends. So the voice is a characteristic of human life and human society. And if you lose your voice, that is a huge drawback. Apart from that, the voice box is also useful and is used for breathing. For a human being to live, you need air to come in and go out all the time. To come in and go out of you all the time. So the voice box also determines that, and it's very important. And then finally, food also passes by there. When you're swallowing food, the voice box closes to let food go to the esophagus. So all those contribute, and you can see it is actually central. You cannot live without that part of your body. Yes.
Yeah, and we'll be having a look at the structure. But Doc, you've talked of the voice box, which is your throat, and the functions of a throat. I think we have it here. Maybe you can explain from there, Doctor, so that you can get a clear picture.
This one is the upper part of it. Here you can see the teeth, you can see the tongue, you can see what you call the uvula, which many traditional African societies love to cut that. They call it keleme, and they would cut that. And then you can see the tonsils, which can also affect somebody. And then at the back there is actually what do you call it, the pharynx, which is the back of the mouth. But below that, just below that, is where now the larynx begins, where you have the epiglottis and the rest of the structures. I don't know whether they've got another diagram.
But that's where exactly it begins, and it runs from there to...
Yeah, it runs from there going downward, now to what you call the epiglottis and the supraglottis. And that will be, I believe they'll be able to show it probably in the next diagram. Yeah, let's see the next diagram.
So, Doc, you've talked about the tonsils, which are, you've said they are outside.
This is a much better diagram. So here we can see the tonsils. This is the epiglottis, which is the cartilage which marks the upper part of the larynx. This is the larynx itself. These are the vocal cords there, and then the part below the vocal cords, the subglottis. So this is the area we're talking about. This is how food comes to go behind there, and then air comes in like that. So both food and air, things that we need for our lives, actually pass through there, and it's a very important part of the body. It's like the Uhuru Highway of your body. If you close that, you're in real real trouble. And in real difficulties.
So let's get to the symptoms for throat cancer.
Yes.
Yes, we do, especially during the cold season, so many cases for tonsils and all that. So do we have typical symptoms for throat cancer?
Yes, indeed. One of the symptoms that is very, very important to note is a change in the voice. Find your voice is hoarse. Your voice is you're losing your voice, or they're changing the voice. You should take an interest in that. Then you can also find your pain when you're swallowing. You also find this throat pain. All those are very, very important symptoms. In some cases, some people have difficulties swallowing. Others have difficulties breathing. So all those are very, very important. In some cases, the pain may also radiate to the ear. In other words, you might feel like it's the ear which is paining, but the pain is originating in the throat. So all those are very, very important. In some cases, you have a neck swelling. You look at somebody's neck, it's an obvious swelling. If they neglect it, the neck can become about as big as a head. It can be that dramatic. So all those are very, very important symptoms which should not be ignored. So anytime you find the voice is changing, there's pain in the throat, and then you find there's difficulty swallowing, you find there's pain on swallowing, there's pain on breathing, there's a cough, then one has to take an interest to try and see what could be happening. Is it just a cold, or is it something worse than that?
And for some type of cancer, we do, some of the symptoms that the doctors will say include tumors. Is it different for throat cancer?
No. All cancers, have a growth that is taking place, an abnormal growth. Because your body is always repairing itself. Your skin repairs itself. The inside of your mouth, where your tonsils are, all those parts are repairing themselves. The inside of your throat, all these areas, the outer, layer is actually shed away, and there's a new layer which forms. But in that replacing itself, something can go wrong. Like with smoking, some of the genes which are supposed to suppress cancers can go wrong within P16. There are others which are oncogenes which cause cancers. They can be activated by the cigarette smoke or by alcohol. So if that happens, a growth begins, and the growth is a cancer. So it can begin in the vocal cords. Okay, then it can spread to another vocal cord. It can spread upward. It can spread downwards. It can spread to the lymph nodes of the neck, causing the neck swelling. So there's always a growth. But when it first begins, which is when we want to catch it, it is very, very small. And from the outside, you cannot see it. So we rely on the change in the voice. Because it is so tiny, you can't see it from the outside. It is growing in the inside.
Ezekiel, welcome once again to my Doctor Show.
Thank you.
Take us through your journey. When were you diagnosed with throat cancer, and did you express some of the symptoms that Dr. Mbira is talking about?
Thank you, Purity. Permit me, before I take you through the journey, to thank you for having me and my childhood friend on the show.
Oh, really?
We didn't plan to meet here. We just bumped into each other at the boardroom after over 10 years of something.
Really?
But we've been friends for enough years.
Okay.
Actually, safely over 40 years. Now, listening to Dr. Mbira talking about the changes, the challenges of the breathing challenge, etc., it's as if he was talking about me, because that's exactly what I experienced slightly over 9 years ago. And I kept on, looking for just the normal medical checkup until one time I went to see my family doctor, who happens to be an ENT. And I was struggling with talking, and you would think I have sinuses. And she gave me some medicine to clear and told me this is congested nostril. It will clear within, say, 2 weeks. But after 2 weeks, it got worse. So I kept struggling, and for the next, give or take, about 6 months, the pain, like he described, kept shifting. Sometimes it's the ear, sometimes it's toothache, etc. So I was forced to seek a second opinion. You don't go for a second opinion to the same doctor. So that's when I was directed to a different doctor, and they found that there was a tumor described at my nasal strip. The process was taken through. I had to go through the CT scan, after which I was told to prepare for a biopsy, from which they would determine whether it has cancer or not. Long short of the story, this was 9 years ago, or 9.5 years back. After all that process, then the doctor pronounced that long scientific name. I don't even want to think about it, but it is when I began treatment and I was just about to be wheeled to my first radiotherapy session, that's when the oncologist who you had in your studio last week, told me, in a layman's language, the cancer you have is called throat cancer. And that's now
Where
the
your journey began.
for beginning to fight this, if you like, terrorist.
Yes, and Ezekiel, you're a very strong person. I've been speaking with you. How was your reaction like when the doctor just pronounced that you had that long name that you do not want to talk about, but in a layman's language, a throat cancer? How did you feel?
Very good question. Before I even come there, I was the last person expected and even thought to have anything similar, anything close to cancer. Why? I grew up a healthy person generally. In the same hospital where I had been a year earlier, I had been checked after falling a bit unwell, and after going through the normal blood tests, etc., the doctor looks at me and tells me, Mr. Libamira, your blood sample tells us you're very healthy. So fast forward, a year and a half later, when I go to the same hospital and I'm told we are going to test for cancer, I actually thumped my chest and said, this man can't have cancer. But after going through the process, the doctor was even shocked, was even scared of breaking the news to me. And this is how he did it. I cannot forget. He couldn't face me because earlier on, when he took me through biopsy and a local anesthesia, it was the most painful thing I'd ever experienced ever since I was born.
How was it?
I remember him telling me at the end, you are my bravest patient. I got angry with him, but I didn't react. I told him, doctor, stop flattering me. And I left it there. But after a week, he looked at me when I entered his office and he shouted, my bravest patient. That's when I believed. So when he looks at the report, he couldn't face me on the eye. As a trainer, I could read body language. And these were his words. Mr. Libamira, I have some not good news for you, and I have some bad news. You're waiting to be told whether you have cancer or not, and that I think he was struggling. He didn't know how to break. He didn't think I would have cancer.
Yeah.
The first thing, like most cancer patients think about, is to think about death. I am no exception. I thought about death, but I began fighting it instantly, and I began speaking with due respect to all religions listening. I began talking to God, and I told God, it's not my time. You can't take me now. But the doctor was talking to me, but I am quietly talking to God. And I gave God some reasons, not conditions, reasons as to why I should still be around. That's how I began fighting it. And then from there, you begin to think of how to break the news to family and friends. It was one of the toughest struggles.
Yeah, and 9 years ago, the cancer cases were really not really common, so I can imagine the kind of stigma that someone would face then. But Doka throat is a part of our body that is hidden. It's not like diagnosing breast cancer, which is just exposed. So how do you go about it?
First of all, we take the history, which is what we've been talking about, what the patient actually complains about, and then we examine the throat. In examining the throat, is something we call flexible laryngoscopy, where you put a tube, a fiber optic tube into the nose or into the mouth, and then we're actually able to shine light and to actually record exactly what is happening in that particular area. Using that, we are able to actually see the small growth that is there on the, most likely on the vocal cords or even in the parts surrounding it.
Is it painful?
Yeah, but we give you a local anesthetic so that it's not painful. There's another alternative where you can go to theater where we do what we call direct laryngoscopy, where you actually use straight, almost metallic instruments, and then you're actually able to see it nicely. And then we're able to take samples, because for any cancer, you have to take the tissue and take it to the laboratory for the diagnosis to be confirmed. Because cancer is a very, very serious diagnosis, so you cannot take a chance or guess, because also the medications given and the radiotherapy which can be given can be devastating to a patient. So you have to really confirm. And the way to confirm is to take the tissue that is swollen, and then it's sent to the lab So we normally do that during the laryngoscopy. We take the tissues, which you call a biopsy, and then we send it to the lab. In the event there's already an obvious neck swelling, which even the patient can see or we can see, we can use a needle on the neck to put the needle in there and remove the cells. And that can also give us a diagnosis, because we always have to confirm if it is cancer. We can look at it, it looks like cancer, we think it's cancer, but we have to confirm, and that report has to be written and documented and always available to the patient and in the file, so that the rest of the management is based on that.
And Ezekiel, you say that it was painful. It was a painful experience. Maybe is that what the doctor is saying? Is that how for you diagnosis was like?
Certainly, yes, it was. I mentioned earlier they had to do the biopsy through the nose, and I didn't imagine. In fact, initially, I was imagining it would be obvious they would do it through the mouth. He described something earlier which I went through. Struggling with breathing, struggling with talking, struggling with swallowing, and also struggling with hearing. Those, I went through all those. So I couldn't imagine that they would do a biopsy, like he said, remove the tissue through the nose. And I just had to fight it, because you see, remember, it's something that you're not imagining. In fact, initially, by the way, let me just go back a little bit, and just before I went for that process of the biopsy, the earlier doctor had told me that when you go through biopsy, we will expect that you won't have cancer. He didn't say that, but he told me these words, I still remember. 80% of the patients who go for biopsy don't end up having the cancer result. And that's when I thumped my chest, believing I'd be one of them. But when this comes, you're struggling between the fear of unexpected, and then you're also struggling with what will be the process of dealing with that serious, so known as a killer disease.
And Ezekiel, what did the doctor tell you could be? Because you say that the doctor said your blood sample did not show any sign of or any problem. He said you are this healthy person. So what did the doctor, how did he explain, and what did he say regarding the cause of that? What could have been the possible cause of that, according to the doctor's report? Or he couldn't explain as well.
Very good question. And Dr. Mbira here, I'm sure he'll smile, because when I broke the news to him just before we walked in here, that I had throat cancer, he asked me a question: were you smoking? So I remember the doctor telling me, stop smoking. And it was my second time to get angry with him, but I didn't react. I said, this man here, and Dr. Mbira can confirm, I have never smoked, and I never drank. But I was like, I'm fighting something more serious than being told, stop smoking. I just said, okay, he's a good guy. I think I'll pay him a visit soon and tell him here I am. So he never actually broke the news, but I think there's that, because smoking, from what I've read, is one of the leading causes of lung cancer and subsequently throat cancer. Yeah, so I think that's so. But he said something interesting. Later on, as I did research and I followed information, I'm a public speaker. I do a lot of training, I do a lot of teaching and motivational talking. So somebody once said that a lot of cases of let me call them the men of the cloth, they end up reporting throat cancer. So I said, okay, perhaps that's one of the causes. I think he brought it out so well. Yeah.
Okay. And Doc, now just take us through the risk factors to throat cancer. For him, it was different, but what are the possible risk factors?
Of course, smoking is a major risk, and people, if you're a smoker, stop smoking. Yeah, it's in your best interest. Smoking is not good for you. Apart from throat cancer, of course, you can also get lung cancer, which is very common. And even apart from those cancers, smoking often obscures other illnesses. For example, if somebody is a smoker and they start coughing, they always think it is a smoker's cough. But maybe it's a lung cancer, maybe it's a throat cancer, but they don't know because they've been coughing due to the smoking. Or they may even have tuberculosis. You remember even one medical doctor who was a colleague of ours, he died of tuberculosis, mainly because every time he was coughing, he imagined it's because of his smoking. And so he ignored the symptoms. Yeah, and he's not the only one. Another one died of pneumonia because he was a smoker and he thought this cough he has is because of smoking, and what he had was pneumonia. So it masks other illnesses and can even kill you, apart from the cancers, even from more common illnesses that could otherwise be solved. So smoking is very, very important. Alcohol use, everything in moderation. Excess of anything will always harm you. So whenever you're going to take alcohol, it should be moderately on social occasions, maybe once a week at most. But anytime you take alcohol 2 or 3 times a week, you begin to increase your risk, and that's a very, very huge thing. Human papillomavirus, is a virus that is very common now, and that can also, lead to that. Of course, nutrition. And nowadays, of course, the economic issues, food is expensive, vegetables, fruits are expensive, but one needs a balanced diet so that the factors you get from those foods can actually go a very long way. Then, of course, early treatment of any symptoms you have, like you have, acidity, hyperacidity, heartburn, get it treated, because it can also contribute to all of that. And then, of course, the environment we live in nowadays is very, very polluted. There are cars, which produce a lot of, smoke, or there are all manner of, pollutants in the air from all the buildings that are going up. So all those contribute. Of course, all the stories we're hearing about sugar that has got all manner of chemicals, all this can actually aggravate that. But the most important thing for the upper airway is what you're breathing in and what you're eating, because those are the issues which will actually end up, being there.
Yeah.
Of course, family history of cancers is also very, very important. Yeah, and then any other illnesses which can compound, whether you're having diabetes, whether you're having HIV, all those things can lower your immune system, just like alcohol and poor nutrition can lower your immune system, and therefore end up manifesting those kind of cancers. Yeah, but above all, when you go early for medical treatment, it's easy to stop the process early and get you cured. That's why you see he's alive more than almost 10 years later, because he went early. If you're delayed, he would not be here. Yes.
Yeah, and Doc, maybe also let us understand whether we have a group of people or who is at a risk of getting throat cancer in terms of gender and also the age bracket.
Yes. Generally, throat cancer is a male problem. In most of the countries, there are more than 4 males for every female. In Kenya, it's even much, much more. You'll find almost like, 30, 40 males for every female. It's a very, very male issue, mainly also because the risk factors tend to be male-oriented. In our society, women generally didn't smoke. It's only now they're starting to smoke. Yeah, now the young people are all taking shisha, which is even worse than cigarettes. So with time, you'll find the women catching up. Even in Europe and America, the women, lung cancers and throat cancers caught up years later as more and more women actually smoked. So that one is a major contributing factor. And then also age brackets. Normally, even if you smoke, it takes almost 20 or 30 years for you to see the throat cancer. So you tend to find people in their 40s and above 40 are the biggest ones at risk. Rarely do you find it people younger than 40. So generally, that tends to be the case. So that it's the older ones. 40 to about 65 is the biggest, age group.
And the director says we have someone calling us live. Can we get to hear what she has to say?
Yes.
Okay. Hello, Valerie.
Hello.
Hello. Hi.
Hi.
How are you today?
I'm fine.
You had a concern?
Yeah, about cervical cancer, the symptoms and maybe the causes and stuff.
Okay.
Yeah.
Okay, the doctor is trying to just answer her. She
Okay,
has a
no
concern
problem.
on cervical cancer.
Okay, cervical cancer is obviously very far away from throat cancer,
Yeah.
but symptoms tend to be bleeding between the periods, bleeding, when not expected, bleeding after sexual intercourse, and pain, when passing urine, pain in the lower back. So all those are symptoms. And in cervical cancer is also preventable, because most of the cases are associated with a virus known as human papillomavirus, which is sexually transmitted. And you can be tested for this virus. If you're negative, they even have vaccines now. You can actually be vaccinated against this to prevent that. Over and above that, it's very, very easy to pick up cervical cancer long before it becomes, cancerous, by doing an examination known as a pap smear. And women are encouraged to go for a pap smear once a year or once every 2 years, and that can pick it up very, very early before it becomes a proper cancer, and it can be treated. The danger with those cancers is when you delay. Any cancer, when you delay, you give it advantage to take over your body. But if you go early, many of them can actually be cured, through various forms of therapy, and before they get out of control and affect other organs.
And Dr. Mbira Gikonyo, thank you so much for your time. That's the end of the first part of the show. We do appreciate that you could join us. And we take a very quick breather. When we come back, we still continue with this discussion, but we will be joined by Dr. Caroline Muturi, who is also a head and neck specialist. But in studio, we'll still be having Ezekiel Libamira to just take us through the treatment journey, how it was like. Call us live. The number is 0791 478 990. Talk to us on Twitter at Ebru TV Kenya, at Purity_Museo. Use the hashtag #MyDoctor. Do stay with us. We're coming back with more, especially on screening and treatment options there are for throat cancer. Welcome back to the second and the last part of My Doctor Show. Just in case you're joining us for the very first time, my name is Purity Museo, and our topic of discussion today is throat cancer. Earlier on, we had Dr. Mbira, who is an ENT surgeon, was taking us through what a throat cancer is and what are some of the risk factors. But on the second part, we will be having Dr. Caroline Muturi, who is also the head and neck specialist. In studio, we do have Ezekiel Libamira, who is a throat cancer survivor, just helping us understand how it was like, all the journey with throat cancer. Remember, this is the only time you have to call us live in case you have any concern, or even if you are a cancer survivor, just encourage us here in studio. Use the number that is displayed right at the bottom of your screen. Before we get straight into a discussion, let's see what we have prepared for you on our home remedy segment. Still watching My Doctor Show, and throat cancer still being our topic of discussion today. In studio, we do have Dr. Caroline Muturi, who is just seated next to me, and Ezekiel Libamira, who is a throat cancer survivor. Welcome, both of you, to the second part of the show, and welcome for the first time to My Doctor Show. So let's begin with you, Ezekiel. We stopped at the doctor breaking the news for you, but how were you able to accept the news and also go ahead and break it to your family, and how did they take it in the first place?
Wow, very good question. Maybe let me start by saying, did I survive cancer? I think I went beyond. I conquered it.
Yes.
And that's why many people out there call me throat cancer conqueror.
All right.
Now, like I said earlier, breaking the news was one of the hardest things because, one, I come from a very large family. 2 years earlier, we had our first death in the family. We were still recovering from that. So what happened is that the doctor tells me words I couldn't forget. He says, when we treat cancer, we treat the family. And I listened to him very carefully, and then he told me, as you explain or break the news to your family members, please make sure you tell your parents last. Having schooled in Nairobi, and I love Swahili, there's a Swahili saying, uchungu wa mwana aujuae ni mzazi. And I thought that's the reason it says, tell your parents last. But interestingly, I took my phone, sent to my family members, and right now that the World Cup is going on, I can tell you we were blessed with a big family, a football team and 2 reserves. And I texted them and told them, a tumor has been found in my nasal strip, and it is malignant. I knew they may have a challenge in understanding the word malignant, so I put in bracket cancerous. Listen carefully, Purity. For 3 weeks, not a single of my family members spoke to me or got in touch with me. I realized they were broken. The biggest challenge for me was how I'll break it to my children, who are already struggling with another very big challenge, and to hear that daddy has cancer. I struggled. I never broke the news to them. The only thing they knew, there was a tumor. And my firstborn son asked me, is it cancer? Not immediately, after a couple of weeks. And I told him yes. And he contained himself from getting angry. And he asked me, Daddy, why didn't you tell us? I can't remember, I fumbled with my words, but that's where the process of treatment began. I will be forever thankful to a nutritionist called Catherine Dungo. She spoke to me and told me, Zach, that's the name they call me out there. The simple treatment for cancer is to boost your immunity and to cleanse. And thereafter, I began walking their nutritional way. But meanwhile, I have to go for the conventional treatment, for which chemotherapy and radiotherapy had been recommended. As a person panicking and getting scared of surgery, I still got a third opinion. And the third opinion insisted on surgery. He called it debug, D-E-B-U-G. He said your tumor is too large to be dealt with by chemo and radio alone. I was so scared of surgery. I didn't tell him that I don't want to. The Kenyan that I am, I sought another opinion. And I met a team of surgeons and an ENT specialist who was my family doctor. And they said, no surgery here. And I think part of my early signs of healing began there. When the thought in me is that I'm not going to go through surgery. But I accepted chemotherapy, which I didn't understand what it was. I knew it was injecting some stuff that goes into your system to go and fight the cancer cells. That is a journey. I have said many times, I would not wish my worst enemy to go through even 5% of what I went through. Today, I have upgraded that statement. I don't think you want to hear this. I usually say, I would not even wish the terrorists, the ones you hear of, to go through that.
Yeah. And you'll be telling us more into that. Once again, Dr. Caroline Muturi, welcome to my doctor show.
Thank you for having me.
Yes, thank you for making time for us as well. Now, Doc, take us through some of the tests there are for throat cancer, because we understand where the throat is located, how simple, how easy it is to to just undergo, or for a patient to undergo some of these tests that there are, and which ones are they in the first place?
All right. So when a patient appears in your clinic, in your office, or they've been admitted in hospital, and you have that suspicion that this patient actually might be having throat cancer, so the various tests that you may think about will basically think about the person as a holistic.
Yeah, and Doc, allow me to pick one more call.
Yeah.
Just one,
All right.
then we continue.
Yeah.
All right. Hello.
Yes.
Hello, hi.
Nilikuwa naulizia kuna nini nimeona hapa kwa kwa TV hapa hivi, kaona wacha niwapigie simu.
Asante.
Sasa niko na shida ya throat. Nimekaa karibu miaka 10. Sasa nikaona wacha niwapigie. Sasa kwa sio nimekaa karibu miaka 10 sasa, nilikuwa nauliza hiyo unasikia vinaongea hata na
Just punguza sauti ya TV yako.
nilikuwa naambia
Uh-huh.
niko na shida ya growth.
Uh-huh.
Nimekaa kana almost 8 kutoka 2010.
Iko na shida gani? Nakusikia.
Sasa nimekaa nayo sasa, gaenda hospitali, ona siwezi fanyiwa surgery hapa kwa growth hapa, sasa naogopa mimi. Sasa nilisikia hivyo, hiyo zote nitakaikue kanza, nilikuwa nataka nione huyu daktari.
Okay, asante. I think I've heard what he's asking.
Okay.
He's having a problem with the throat. I don't know especially what the doctors say after if he went to seek any medical attention, but he's saying he's afraid of the surgery.
Okay.
How do you help that person?
We understand that for any person who has been advised that a surgical procedure has to be done, there's always the fear of being taken under the knife, and also sometimes having to go through anesthesia, which majority of the time will be general anesthesia. I think for such a patient, you need to sit down, listen to their concerns, and understand where they're coming from, and also give them information that they will understand in terms of what are the risks of anesthesia, and what are the risks of doing the surgery themselves, and what are the benefits they actually will gain from going through the surgery, so that they have a very clear point of view of why you are advising them for such. And then if the patient is very anxious, there's no problem with actually asking a counselor to sit with them so that they can actually air their concerns as well. They could be having anxiety, maybe from a previous experience through a loved one who had a bad reaction to a surgical procedure, and that's fine. So you can take them through that, so that when you arrive, when the patient makes a decision, they don't feel like they've been pushed to it. But if you really feel that this patient will benefit more from the surgical procedure, make the patient understand from your perspective why it will benefit them. I think that would be the best advice. Yes.
Okay, and you'll be telling us more when you will be talking about the treatment options for throat cancer. But before then, there are some photos that you sent me. Ezekiel, am I allowed to use them as you continue to tell us your journey with throat cancer? Now, Ezekiel, take us through the symptoms after being diagnosed with throat cancer. Did they end there or did they continue? What were the long-term symptoms for you like?
Good question. The first is within 3 days of having started chemotherapy and radiotherapy, I could not taste anything. Zero. They recommended 33.
And this is your, maybe you can tell us, is this your after
Okay,
diagnosis?
this is after 1 year. After one
After
year.
1 year with cancer.
This is me before. This is before.
Yeah.
I was a very big person, over 100 kilos. This is more recent when I got involved in cancer advocacy. But this is when, again, I had just joined. After 1.5 years, I had joined the cancer support movement. There was a picture earlier, I don't know, maybe it's missing.
The first
this
one?
is after exactly 1 year. I had lost almost 50 kilos. According to an oncologist I listened to, I was technically dead. Because they say if you lose 20% of your weight suddenly, you're on the verge of death. I lost...
This one, let's just stick to this. This one was before your
This
diagnosed?
is before.
Yeah.
Over 100 kilos, almost 110 kilos. Then during treatment, I lost close to 50 kilos. I reduced to 61 kilos. I looked like a person who, you wouldn't recognize me. I couldn't forget people used to meet me and they just pass. I say a high purity and they pass me because from this mass and just remove 50 kilos from there, you're removing a whole human being from me. But then after 1 year, after going through the 33 sessions of radio, after going through the normal sessions of chemotherapy, And then at the same time, I applied the use of lots of nutritional support. You may call it excess, but of course, under guidance. And that helped to boost my immunity, and it helped to just get the process going. And this is where I was saying, after 1 year is when I gained 5 kilos.
So maybe what was the reason behind the loss of weight? Was it because of the treatment that you were undergoing, or also because of the trauma and the stress? Because you earlier on told me that after breaking the news to your family for 3 weeks, they did not speak to you. One, did you take it lightly, or as well did you interpret it as my family has also left me? What was your interpretation like first?
I guess a combination of what you've said, the trauma. One, I mentioned earlier, I lost taste. Number 2, I lost appetite. Eating was a fight. Number 3, I experienced mouth sores, so you can't even eat. Number 4, when you take painkillers, because the pain of a cancer patient, you cannot describe. Because it's pain that keeps shifting. It's not like a headache only. And I often say, with due respect to the Daktari here, even the best oncologists in the whole world cannot explain what a cancer patient is going through. You can imagine you're taking painkillers to suppress the pain, and the water passes through your gums, and the water is painful when it passes your gums, because the effects of radiotherapy. I couldn't forget the tongue I would be so dehydrated that when the tongue dries up, when the tongue moves, listen carefully, you feel as if a razor blade has passed through your tongue. I wouldn't blame, I'm sorry to say this, I wouldn't blame people who give up. I almost did. I almost did. But then a good support structure, of course, the reasons you put behind that, I must fight this quote-unquote terrorist, that kept me going. And that's why I'm here today.
Dr. Caroline, kindly take us through the treatment options for throat cancer.
Right, so the treatment options that usually exist will be based more on what you found for this patient. First of all, you'll have to do a CT scan of what we call of the neck, because you actually want to see the affected areas, the surrounding tissues, are they involved, and they're very important structures like the vessels in the neck. We have the thyroid gland, which sometimes you actually want to see, does it look involved, because it can be affected by the treatment or the disease. Some patients have to go to the operating room, not for a surgical procedure, but for the biopsy process, especially if you're having cancer of the voice box or cancer in other parts of the throat where we call the hypopharynx. You will need to take them through chest x-rays, you need to take them through abdominal ultrasound, because one thing before we even come to treatment is we have to stage. So this patient may have spread of disease into the lungs, and that's very important.
So how do you stage throat cancer?
Now, staging is done through a very internationally agreed upon staging system that was actually developed by a joint commission from various countries, which are usually out of abroad. So mostly American and European commissions will sit together and come up with a staging process that will be accepted well over. So for staging, you look at the tumor size, you look at the nodes that we may have.
Someone is asking what staging is.
Yes. Yeah. So staging is actually a process where you actually put a patient on either early disease or late disease. And that gives you prognosis in terms of what are the chances of survival for this patient when they go through treatment, and for how many years will you also follow them up before you actually declare them cancer-free. That's the staging process. That's the significance of staging. So you need to do a chest x-ray and abdominal ultrasound to check for either spread of disease to areas that are either near the cancer area that is affected or further than that. And if somebody has spread, it makes the disease are more harder to manage or chances of achieving cure. So staging, you can be told either you're stage 1, 2, 3, or 4. So those are the existing stages. Once we have staged, then you discuss the treatment options for the patient. And I'm glad that Ezekiel is there because he's mentioned the treatment options for throat cancer that we go through. So we do have radiation therapy, which is basically radiotherapy, where you use X-rays, rays that are X-ray, but these ones are usually targeted to the cancer cells, okay? Then we have chemotherapy. So these are basically drugs that are targeted at killing the cancerous cells. Why? Because cancerous cells usually are abnormally growing cells, meaning the fact that the size of the tumor goes increasing, there's also a fast rate of growth for these cells. So the disadvantage we have with chemotherapy is that other parts of your body also have a rapid rate of cell replication. Like he has said, he developed sores in the mouth, isn't it? Yeah? Even the skin gets affected. These are areas where our cells divide very rapidly. And so as you being administered chemotherapy, it will affect even areas which have rapid cell replication rate. Then we have also combination of the two. So one patient may go through chemotherapy only, another patient may go through radiation only.
Depending with the staging?
Depending with the staging,
Right.
the age of the patient, and also the type of cancer that the patient has, okay? And a patient may go through these two treatment modalities. That is, you can have chemotherapy and radiation, or you can have radiation first, chemotherapy, as you finish your radiation, start on chemotherapy. And surgery also plays a role. He mentioned something important. There's something we call debulking. So the tumor can be large. You want to help the patient, or maybe the patient is for palliative care. So even palliative care is a form of treatment where you can debulk the cancer and continue taking care of the patient. And surgery can be the primary mode of treatment that is done where you actually remove the whole cancer and follow up the patient and leave radiation therapy or chemotherapy later if there's recurrence of the cancer. Yes.
And Ezekiel, how did some of these treatment options or the kinds of treatment that you had to go through affect you generally as they were trying to control the cancer that you, or the tumor that you had? Did it affect you, the chemotherapy, the radiation affect you generally? How did it affect you?
Certainly, I think we are in agreement with the medics that boosting of your immunity is very key in fighting the cancer cells because it suppresses them and prevents them from rebelling and continuing to multiply, which they do multiply. According to the National Cancer Institute, they multiply in billions. Now, the report I have read is that chemotherapy, while it is killing the cancer cells, subsequently also interfering with other cells, it lowers your immunity. And when your immunity is lowered, you give a chance for the opportunistic disease to come in. I could forget, after a year after treatment, I had to walk on a crutch. Why? Because I struggled with my joints and pain, and when I went to see a doctor, my hands were swollen and they were not even bending. Before even doing a test, she just told me that is arthritis. And when I got a check, even though the report didn't come out as arthritis, but all those were signs. I have since suffered other challenges, maybe not directly, but like I say, they could be as a result of the immunity being compromised, which of course was due to the effect of the chemotherapy, I believe. And I remember when you sit there and you're waiting with people to do chemotherapy, it takes time and you begin to make friends. And you're there for 2 hours. It's a long period. So everybody is telling me, my chemotherapies are 6 cycles, but mine were 3. I had to ask the chemotherapist, why are the rest 3? 6 rather,
6, yeah.
and mine are 3? She gave me these words: your case was serious, and we had to administer a double dose. And I understood, no fight. I just said, as far as I was concerned, forget about what people talk about, the dangers of chemo and radio. As far as I was concerned, I was in the process of treatment, and I employed both conventional treatment and nutritional therapy.
Yeah.
And that really helped me. Of course, the most important, the one that helped me most, was the mind. Let me say this. This is very important, Dr. There's a saying, information is power. And when the oncologist told me, the cancer you have is called throat cancer in a layman's language, immediately I remembered a rumor that there was a leading personality in East Africa who had throat cancer. And I counted the number of years and said, this guy was said to have throat cancer, a very senior leader in the nation. And I said, he's alive? 13 years later, I spoke to myself and I said, I am going to live. And that helped me a lot. In fact, let me finish with this as I describe that. I also remember the doctor telling me, some people have been lucky to go through chemotherapy without being admitted in hospital. I took a look at her and I told her, this man, you will not admit him in hospital. And many other factors that really helped me walk through the journey.
Okay, thank you so much, Ezekiel. Such an inspiring story, and we thank God that you are able to conquer. And Doc, we are finishing the show, so maybe in a few seconds, like 10 seconds, just tell us, is there a way we can prevent it, you know? And also a take-home message. For example, if we have some symptoms like tonsils, is there a cause for alarm for a throat cancer, or is it something different from that? In 10 seconds, please.
All right.
Yeah.
So I cannot emphasize more than what Ezekiel has already put forward, nutrition. Not only is it a method of where you can actually help yourself to reduce effects of cancer on yourself as you go through treatments and also reduce chances of recurrence, it's also a preventative measure that we should actually take. We've changed our diet, and we need to actually go back to that.
Okay.
And what was the second part of it?
A take-home message. But I think
Take-home message,
you've talked
yeah,
about nutrition.
yeah.
Thank you so much. That's all the time we had for the show.
Thank you.
Dr. Caroline Mutori and Ezekiel, thank you so much for your story. Such an inspiring story. We're looking forward to having you once again in the show, and also make the public understand how do we take care of ourselves, and also how do we set our minds to just ensure that it's never going to bring us down. Thank you all for watching. The show continues tomorrow, same place, same time. My name is Purity Museo. See you then.